Chronic obstructive pulmonary disease, a real-world problem. Meet John. 10 years ago, John had been getting more and more breathless doing everyday things, such as climbing the stairs and walking his dog, Randolph. His doctor told him he had COPD, chronic obstructive pulmonary disease, a progressive lung disease that is also called emphysema and/or chronic bronchitis. He's one of 210 million people worldwide with the disease, and its main cause is smoking. Due to its progressive nature, the early diagnosis and treatment of COPD is essential to prevent complications and exacerbations, worsening of symptoms, associated with the disease. According to GOLD, Global Initiative for Chronic Obstructive Lung Disease guidelines, a clinical diagnosis of COPD should be considered in any patient over the age of 40 who has breathlessness, chronic cough or sputum production, or a history of risk factors for the disease. It is often undiagnosed in its mild and moderate stages, as symptoms such as breathlessness are often initially attributed to aging. Many patients do not seek medical care until symptoms have become severe, and it has been estimated that up to 75% of Europeans with COPD are undiagnosed. Diagnosis of COPD is confirmed by spirometry, a simple test which involves a patient blowing into a machine. An exacerbation, sometimes referred to as a COPD lung attack, is defined as an acute worsening of clinical symptoms, for example breathlessness or sputum production, that requires acute treatment and can lead to hospitalization.
Я погибал просто. Синие губы совершенно бледные, задыхающийся, мне даже было страшно. Вот жена помнит, когда я вставал и говорю, я конец, я не знаю, что хватать, что делать там.
They take me into hospital, they keep me on oxygen for about, anything up to 4 or 5 days. I can't go outdoors very far.
Exacerbations add to the morbidity of the disease, add to reduction in quality of life, hospitalizations, lost time from work, and there's also good evidence that the disease itself progresses quicker in patients who exacerbate more frequently.
Economic analyses suggest that hospitalization due to COPD exacerbations accounts for 40 to 70% of all medical expenses for patients with COPD.
C'est contraignant, c'est que je ne peux plus faire ce que je voudrais faire. Ce qui me ferait énormément plaisir, mais je ne peux plus le faire parce que y a ce problème de maladie, malgré tout, qui est là. Il y a le souffle qui ne va plus.
The risk of COPD exacerbations can be reduced with the use of long-acting bronchodilators, for example long-acting anticholinergics, as first-line maintenance treatment as determined by GOLD for moderate to severe COPD. First choice for GOLD patient groups B to D, second option for patient group A.
It opens up the airways and it just releases the air from my lungs.